Hello and welcome to The Explainer. That time after you've had a baby is, well, it's a whirlwind of change, right? But it can also come with a few health hurdles. So today we're going to talk about something that's super important but doesn't get enough airtime: postpartum infections. Now, the goal here is not to scare you at all. It's about giving you the know-how to protect your health so you can feel confident navigating this new chapter of your life.
So here's our game plan. We'll kick things off with the one number you absolutely positively need to remember. Then we'll get into the four most common infections, what might put you at a higher risk, and exactly what symptoms to look for. And we'll finish up with a clear, simple action plan and some great prevention tips. Sound good? Let's do it.
All right, let's just jump right into the deep end. Seriously, if you only remember one thing from our whole chat today, I want it to be this. We're about to share a single piece of info that could genuinely make all the difference. So let me ask you this. When we're talking about your health after giving birth, what's that one number that should be on your radar? You know, the one that signals it's time to pick up the phone and call your doctor, no questions asked.
That number is 104.4 degrees Fahrenheit. That's 38 degrees Celsius. If you see this on a thermometer anytime after that first day postpartum, that is a major red flag. It's the number one sign of a possible infection, and it means you need to call your doctor or midwife immediately. No waiting, no, let's see how I feel tomorrow. It's a call you have to make.
Okay, so think of that fever as your body's alarm system. It's telling you something's up. But where exactly is the problem? Let's look at the four most common spots where an infection can set up shop after you've had your baby.
First on our list is endometritis. This is just a fancy word for an infection in the lining of your uterus, the endometrium. Here's a way to think about it. When the placenta detaches, it basically leaves a wound inside your uterus. And that spot is a prime target for bacteria, which is exactly why this is the most common postpartum infection we see.
Next are wound infections. This one is pretty much what it sounds like. It's an infection that pops up at the site of the C-section incision or where you had an episiotomy or any tears from delivery. You know, anytime the skin is broken, there's a risk of infection getting in.
Then there's mastitis. This is an infection in the breast tissue. It almost always just affects one breast, and it's pretty common, especially in those first few weeks of breastfeeding. But you have to take it seriously, because if you don't treat it, mastitis can turn into a really painful abscess that might need to be drained. And last but not least, the good old urinary tract infection, or UTI. During delivery, it's pretty normal for your bladder to get a bit bruised up and swollen. That can make it tough to empty it all the way. That, plus maybe having a catheter, can create the perfect storm for bacteria to grow and cause a UTI. So now that we know what these infections are, you're probably wondering, well, what are my chances of getting one? The truth is, anyone can get an infection. But, yeah, there are certain things that can definitely raise your risk. Let's take a look at what those are. As you can see, things like having a C-section or a really long labor can up your chances. It just makes sense, right? These situations can create more opportunities for bacteria to get into your body. Same thing goes for having your water broken for a long time, or lots of vaginal exams. It's all about exposure. But remember, and this is key, these are just risk factors. They are not a guarantee you'll get sick.
Okay, so we've covered the what and the why. Now for the really important part, the how. How can you actually tell if you have an infection? What are the specific signs you need to be on the lookout for? This is where you become your own best health advocate.
And this is a really, really important distinction. A lot of these infections will kick off with those vague, I just feel awful symptoms, body aches, chills, just feeling totally wiped out. But the real clues, the things that tell you what's actually happening, are the localized symptoms. They're specific to one part of your body, and they help you and your doctor figure things out fast. So if it's endometritis, you're going to feel it deep in your belly and pelvis. Your uterus might feel really tender to the touch. And pay really close attention to your lochia. That's the normal bleeding after birth. If it suddenly gets way heavier, darker, or has a bad smell, that's a huge sign that something is off. With a wound infection, your body gives you some pretty clear visual signals. The area around your incision or tear will look red, it'll be swollen, and it'll feel warm when you touch it. It's also going to be painful. If you see any kind of pus-like fluid, or if it looks like the edges of the wound are starting to come apart, that's your cue to call the doctor.
Mastitis. It often hits you like a ton of bricks. You'll feel a painful, hard lump in one breast, and the skin over that lump will be red and hot. You might also feel swollen lymph nodes in your armpit on that same side. And then on top of all that, you'll probably have a high fever and feel like you just got the worst flu of your life. It's a real double whammy of local pain and system-wide misery.
And with a UTI, all the signs are centered around, well, peeing. You'll feel like you have to go all the time, and then when you do, it burns. Ouch. You might also have some general discomfort in your pelvic area, and your urine could look cloudy or have a strong smell. These are all classic UTI signs. All right, so you've spotted some of the warning signs. What now? This is where you take charge. This is not about panic. It's about being proactive. Here's your game plan.
Here is it, your 4-step action plan. Super simple. Step 1, recognize the signs. You know your body better than anyone, so trust that gut feeling. Step 2, contact your provider. Don't wait to see if it gets better on its own. The sooner you get treatment, the faster you'll heal. Step 3, follow your treatment plan. It'll probably be antibiotics, rest, and lots of fluids. And step 4, and I cannot stress this enough, finish your antibiotics. Even if you start feeling a million times better, you have to take the full course to make sure that infection is completely knocked out.
We've spent a lot of time on what to do if you get an infection, but, an even better plan is to not get one at all. So let's wrap up with some simple, proactive things you can do to protect yourself.
Honestly, prevention really comes down to building good habits. First, get serious about hygiene. Wash your hands all the time, especially before and after you use the bathroom or change your pad. Always wipe from front to back and change your pads often. Second, fuel your body so it can heal. A diet with plenty of protein is great for tissue repair, and drinking tons of water helps flush everything out.
And when it comes to preventing mastitis, it's all about the little details. Make sure your baby has a nice, deep latch to avoid hurting your nipples. Try to empty your breasts completely at each feeding, so milk doesn't get backed up. And wear a supportive bra that fits well, but definitely no underwire. These little things can truly make a huge difference.
I really want to leave you with this thought. Knowledge is power. This whole conversation isn't about making you anxious about every little ache or pain. It's about being in tune with your amazing body, knowing what to look for, and feeling totally empowered to speak up for your own health. You've got this.
And that's our look at postpartum infections. I really hope you found it helpful. The bottom line is always trust your gut and don't ever hesitate to reach out to your healthcare provider if something feels off. Thanks for watching.